Welcome back to Biology 2210 Lab, Anatomy and Physiology 1 Lab at CNM. This week's topic is the cranial nerves, and this will be a very short video simply showing you the location of the 12 pairs of cranial nerves on the bottom of our brain model. So we start by zooming in so we get a good look at the bottom of the brain, and we're going to start. Oh, one sneaky little trick that you might be able to use on tests is that all of these cranial nerves on our models are numbered with Roman numerals, so 1, 2, etc. So if you can remember the sequence, that might help you with simple identification, though there's no guarantee on an exam that you'll be able to see the numbers. On a typical exam, it's possible that they may be covered with tape, and on a picture it's possible that they may not be present. But if you do happen to get a photograph of this model or see this model someday in person, just know that that's something you can do. Alright, so we start with the first nerve, and that's the olfactory nerve. Now remember, you don't actually see the olfactory nerves. Those are the little nerves in the cribriform plate, but what you can see is the enlarged olfactory bulb and then the olfactory tract that leads away from it. As we move then posteriorly from that point, we then see the optic nerves, the second cranial nerve, the two optic nerves, and here we see them forming the optic chiasma or optic chiasm, the crossover, and then these would be the optic tracts leading out of the optic chiasma. So optic nerves before the crossover, and then optic tracts afterwards. Continuing down on the brain, the next pair we see are the oculomotor nerves. Oculomotor nerves, these two right here. These, remember, are the mammillary bodies of the hypothalamus. So the oculomotor nerves are going to be essentially at the top of the pons, just beneath the mammillary bodies, two oculomotor nerves. From there we move over to the trochlear nerve. The trochlear nerve, we see one on each side. They seemingly come from the recesses and the back side of the pons underneath the temporal lobe, and it might benefit to zoom in even a little closer at this point. Let me get focused here. The camera's having difficulty focusing, so maybe I can't do that. We'll move in slowly. There we go. So the trochlear nerve coming from the side of the pons, and there's the trochlear nerve on this side right there. As we move back, we get to the largest nerve, which is the trigeminal nerve, and on these models, of course, you cannot see the three branches of the trigeminal. You can only see the stump of the trigeminal, and that again is the largest cranial nerve, so a big stump on the side of the pons there. We come forward from there to the abducens, or move back I should say, to the abducens, which is located at the base of the pons, basically between the pons and the medulla. In that little groove between pons and medulla, we see the abducens nerve on both sides. Excuse me. From there we move out to the side of the pons, and we have a pair that sit side by side, the vestibular-cochlear nerve and the facial nerve and the vestibular-cochlear nerve. For some reason on these models, these two nerves are always misnumbered, and I'm not sure why, but if you go back to the PowerPoint, you know that the facial nerve is the first one, more anterior, and then the vestibular-cochlear nerve is the second. So these two sitting side by side, facial, vestibular-cochlear, and on the other side, again, you see them unnumbered, facial, and then vestibular-cochlear, facial, vestibular-cochlear. Alright, from there we then move down onto the medulla itself, and on the sides of the medulla we have two nerves sitting side by side, the glossopharyngeal nerve and then the vagus nerve. So glossopharyngeal and then vagus, two stumps sitting side by side. On this side we would see the, again, glossopharyngeal and the vagus nerve. The vagus is always bigger than the glossopharyngeal. The next nerve down is really the spinal accessory nerve, or just accessory nerve, It consists of several cervical nerve rootlets that actually come off the spinal cord, remember, pass up into the cranium through the foramen magnum and then back out through the jugular foramen. And so we simply identify that one as a series of rootlets on the sides of the spinal cord. Again, that's spinal accessory. And then for our final cranial nerve, we come forward and basically in front of the glossopharyngeal and vagus on the side, in front of those, anterior to those, on either side would be the hypoglossal nerve. Okay, so those are our 12 cranial nerves, and again, from a farther away perspective, it's really difficult to see them from this view. It's just not possible. So any picture you get is going to have to be one that's fairly close up so that you can actually see the structure. So you do want to be able to recognize where you are on these pictures of the brainstem. All right, that's it for this week, and until next time, stay safe.